Assalamualaikum and a very good day, everyone. My name is Dr. Alia Nadhirah. I am a medical doctor working in Kuantan, Pahang. And today I'm very excited to share with you my story. Now, 5 months ago, I was deployed to work in a COVID-19 quarantine center, Bilik Gerakan. And this is where I met Dr. Sarah. Now, Dr. Sarah explained to me the workflow process. Okay, this is the patient data flow for those who are COVID-19 positive. So here, after their swab has been taken, their data will be updated into the public health information system. So subsequently, those who are positive, they will submit this data to CAC, COVID Assessment Center, and they will decide which patients can be quarantined at home and which patients has to be quarantined in a center. So they will give this list in the form of Microsoft Excel to the UCC, which is basically like the middle person to decide which center the patient will be admitted to based on bed availability and based on the patient's profile. So the patient will then be admitted to PKRC, which is what we call the Pusat Rawatan COVID-19. So here, we will use data to assign beds as well as generate statistics and reports, which we will then submit to JKN, Jabatan Kesihatan Negeri, and this is important for them to submit this data to KKM, which is the data that you see daily. Now, on my very first day, I had a lot of challenges. The patients were changing beds by themselves, so this caused a lot of untallied data, and the updates were also not real time. So we had to deal with a lot of inefficiencies because of the current manual system. And that's how me, together with my partner, Dr. Muhammad Izzat, came up with a breakthrough solution called Ibeds, Integrated Bed Entry and Database System. Now, what is Ibeds? Essentially, it's a compact hospital information system made with Microsoft Excel. And today, I will share with you 3 key points why Ibeds is better than the current manual system that we are using. So firstly, Ibeds is exact. Dr. Sarah previously had, when she received data from in the form of Microsoft Excel, there are other data that she needs to generate based on what she has received. For example, receiving the IC, we need to generate the age. So they will actually calculate manually based on the IC. They also need to calculate how long the patient needs to stay. So for example, if they receive the date of the swab taken, they'll need to add 10 days to that to decide the duration that the patient will stay. But with Ibeds, what we have done is that we created a master list that can automate these things and drop down menus to reduce errors and typos. So this has saved a lot of time and makes the data exact. How else is Ibeds exact? We created a bed map which corresponds exactly to the bed map or the center floor layout. So imagine 1,000 beds. Previously, Dr. Sarah would actually have to copy paste manually from the patient list to the bed list, or actually update a whiteboard. Imagine 1,000 patients you're updating on a whiteboard. So with Ibeds, it just automatically updates from the master list to what we call the bed map. And when you go to a shopping mall, you're searching for a car park. What would you search for? Green, right? To see where you can park your car. We're using the same concept here. Available beds are in green. What makes this bed map remarkable as well is that on the left hand side, you can see that we have this dashboard. Now this dashboard gives a snapshot view for administrators for us to see how many beds are available and how many beds are occupied. And we use this information to communicate back with UCC for them to decide how many patients can be admitted to our center. Now, what makes Ibeds exact is because it's customized to the center. Again, it is exactly as the floor layout. So you can have a PKRC which has multiple levels, multiple floors, one hall with lots of beds. It can be a hotel, and we are able to customize this according to the center. Now, what makes Ibeds efficient? Because we have automated the process, the workflow becomes less. Now, previously, what Dr. Sarah had to do was that she had to calculate the census. Now, this census is like the statistics and data that we had to submit to KKM. And imagine that currently the system is that we have to write it on a whiteboard with a marker pen, updating and calculating with a calculator. So this can cause a lot of untallied data and errors as well. So with Ibeds, what we have done to increase the efficiency is by automating the page of statistics and analytics, linking it to the master list. Imagine what you see every day, 20,000 patients, 22,000 patients positive. Where do they get this data from? It is exactly in this current method. This is how data is being generated. What makes Ibeds efficient as well is because we have automated this. So this has contributed and allowed the administrators to actually finish their work on time instead of going back later, just to ensure that data is tallied. And because of this as well, we can make faster and swifter administrative decisions. So for example, patients who require to be admitted, they have to wait to know if the bed is available or not. And it's extremely important for patient safety that these patients are admitted as soon as possible. We need to reduce the patient transmitting this infection to other patients. We need to ensure that this patient is swiftly admitted so they can get early medical attention and be reviewed by our doctors and paramedics. Now finally, what makes Ibeds economical? 3 things. Number 1, in terms of creating it. Number 2, maintaining it. And number 3, using it. So why did we create Ibeds, a hospital information system using Microsoft Excel? Now, data is actually being given to us in Microsoft Excel, and we are also submitting it in Microsoft Excel. So what we have done is actually just automating it and upgrading the current system. And our healthcare settings are varied. We have centers which are in rural areas. So we have centers which have poor connectivity for the internet, as well as slower computer processors. And in order to cater all of this, that's how we use Microsoft Excel as our platform, because most computers are already installed with Microsoft Excel. And how is it economical in terms of maintaining? Well, we do not use any servers and we do not need Wi-Fi. So the system is offline, and we are able to cater to patient data security and prevent any data breach. Our file is also password protected to allow only the users to use it. And finally, medicine is ever changing. And because of the current pandemic, we also need to update it constantly, the data management. And because of this, we can use Excel because it is a custom front end for the end user. And so it's easier for them to make any changes. And because we don't need to train them in Microsoft Excel, and only minimal training in Ibeds. We believe that a system is good if the developer is disposable. Alright, so with Ibeds, we have helped not only Dr. Sarah, but other doctors as well to reduce the administrative burden. And Ibeds is essentially an automated bed management system which links the master list to the bed map and the statistics, which is exact, efficient and economical. And we hope that we can help more people with our system, integrated bed entry and database system, Ibeds. Thank you.
Okey, baik. Terima kasih doktor atas penerangan tersebut. Kita tengok soalan-soalan yang ada ni. Kalau ada soalan boleh masukkan dalam bahagian Q&A, saya akan perhatikan di sini. Tetapi sebenarnya sebelum Jomlaunch ni kan kita dah tengok dah Dr. Alia punya Ibeds ni macam mana dan sebagainya, dan bagi saya memang mengagumkan lah. Tapi sekadar memang saya saja tanya soalan supaya lain-lain semua pun boleh faham kan. Pakai Excel ni kan, dia kita ramai-ramai dalam ni programmer, developer, semua tera-tera hebat-hebat belaka kan. Pakai Excel ni sebelum ni tak ada ke usaha nak buat sistem yang lebih integrated, lebih khusus, web based ke apa dan sebagainya. Satu, tidak adakah? Kalau ada, tapi kenapa pakai Excel juga kan? Jadi kalau yang itu tu macam mana tu?
Alright. Is it okay if I speak in English?
Boleh.
Okay,
Mana-mana yang selesa.
So the question is, has there been software developed before for bed patient management in quarantine centers, and why has it not been? No, so because there has been attempts before. Yes, there are, but it does not seem to be able to fit the quarantine centers. So it comes back to why we are using Excel. Three things. Number one, accessibility, feasibility, and flexibility. As what mentioned, accessibility, they want something that they can easily use. So it's already inside the computers. Number two, flexibility. So they can change it, customize it. Sebab we have changing policies. Patient quarantine daripada 10 hari tukar ke 14 hari, kita kena tambah additional information. That was the earlier management. So we have ever-changing policies in medicine. So that can be easily customized by the user themselves, which is the doctors inside the PKRC. And number three, it is feasibility, the ease to use. So when we develop any programs, applications, we need to train the user how to use it. And we need something which is easy and fast and quick, and something that they have so that they can use it now, instantly. Because at this time, COVID-19, so many cases, we need to submit the data daily. We need something that we are already using. And what we did is that using Excel, we just improved the system from there. Previous attempts at creating a database system was that I think some people, we tried to test it out, but people ended up not using it because they prefer to use Excel. They're already used to it, and they didn't need much training in it, and it was easily customizable.
Mungkin itulah saya bila memikirkan, mungkin juga sebab ni kot, faktor masa nak develop satu.
Yes.
Dan bila develop sistem ni, kadang dia kena lebih teliti, nak kena ada user acceptance test, kena ada final acceptance test. Sebelum tu nak kena buat URS dulu dan sebagainya. Nak apabila sistem yang berbayar kan, keluar tender ni. Jadi faktor masa lah, masa satu.
In addition to that, doctors to go into the red zone to treat patients, but we have limited number of staff, and the staff sometimes changes depending on the center. So because of this, we need we need a system which can easily train the people who are handling the data.
Saya nampak satu minta maaf. Okey, saya nampak satu masalah masa dan mungkin masalah kos kan. Jadi nak sesuatu yang cepat dan pantas, solution yang macam ni lah yang diguna pakai kan.
Minimum viable product, yes.
Jadi di masa hadapan dia macam mana? Ada plan-plan akan dibangunkan lagi ke macam mana?
Okay. So upscaling of Ibeds, there's two ways. Number one, insyaAllah once COVID is over, we won't need to use this system exactly anymore for COVID-19. But it's essentially a monitoring system. We can still use it in hospitals for when we have disasters, floods, when we need to place people in a flood relief center, we can still use this. And essentially, the Ibeds is a monitoring system as well. So not just for patients, but we've actually been able to use it for asset monitoring of surgical orthopedic equipment as well. Yes, we use it. I'm using it also in my department as well. So previously, instead of just writing on the paper, nak ingat how many are available, how many tinggal dah berapa oxygen concentrator, how many more dah guna, we can use this system as well to instantly know who's borrowing, who's returned it, and how many we have left.
Okey. Menarik. Saya sebenarnya itulah yang sayang sikit kita punya tempoh masa dalam pembentangan ni, dalam Jomlaunch ni, sebab banyak projek ni yang kita nak showcase yang kita tak sempat nak tengok demo dia macam mana. Screenshot tadi pun macam kecil-kecil saja sebenarnya, tapi bagi saya yang sempat dah tengok ni sebenarnya bagi saya agak mengagumkan lah. Atas keadaan-keadaan tertentu, saya kadang tu tak ada preference sangat kita pakai teknologi apa. Kan, as long as satu dia meet the purpose, dia serve the needs kan. Benda macam tu, apa yang kita boleh guna pakai, kita guna pakai sahaja. Sama juga macam kawan-kawan programmer pun dia selalu bergaduh PHP dengan .NET lah, Postgres dengan MySQL lah, Azure dengan AWS lah kan. By the end of the day, bagi saya by the end of the day, kemahiran yang ada tu apa yang kita produce kan, dan macam mana dia digunakan, manfaat kepada orang ramai dan sebagainya lah. So sedikit saya rasa daripada kami lah yang umum ni, mungkin usaha ini sebenarnya ada ada fungsi dia dalam the whole COVID-19 punya yang kita duk hadapi sekarang ni kan. Jadi untuk itu kita nak ucapkan terima kasih jugalah atas usaha dan sumbangan doktor dan ahli pasukan yang lain kan. Saya faham ini data nak dikemas kini setiap hari ni tengok MySejahtera berapa nak keluar. Jadi data tu datang dari mana kan. Jadi sefaham saya sikit sebanyak memang daripada sinilah kan. Jadi saya nak ucapkan terima kasih atas pembentangkan dan terima kasih jugalah atas sumbang dan usaha kerja doktor. Baik, terima kasih.
Thank you very much.